It's our Vidant Spotlight here at 8:31. It is always an honor and pleasure to meet some of the great doctors that we have in our medical community here. We have a world-class medical community in Greenville. I'm just hearing this story about a lung cancer patient who is here with us this morning and what Vidant Health has done for her and her doctor. We're going to meet her doctor right now. We got Dr. Mark Bowling with us this morning from Vidant Health. Am I getting that right?
ECU physician.
You're an ECU physician,
ECU Vidant.
and we were talking about the fact that you were a Brody graduate. You got your medical degree here at ECU.
2001.
Yeah, God bless you.
That's the best class.
Now, are you a pulmonologist, a oncologist? What's your specialty?
So I'm a pulmonary critical care physician, but I work exclusively in lung cancer, and my role is to help facilitate diagnosis and any kind of local therapy for lung cancer.
I want you to meet Denise Meacham. Denise is from Goldsboro, and Denise is a current patient of Dr. Bowling's. Good morning. How are you?
Good morning.
With what you said you were nervous. I was like, well, what you've been through? I don't know why this would make you nervous.
It does.
But you were just telling me during the break that what your condition was when you met Dr. Bowling and started getting treated here, and you have credited Vidant Health with not only saving your life but giving you a quality of life you might not have otherwise had. Tell us your story if you don't mind.
Well, when I first came to Vidant, I had a collapsed lung. I had my mass in my bronchial tube, and I was functioning on just part of one lung. I could not walk more than probably 10 feet without my oxygen level dropping. So therefore, I was in a wheelchair and on oxygen at the same time. And they started my therapy. Dr. Bowling did a bronchoscopy, and I don't want to get too much into the medical terms because I'm not very good with them. And I came here for a second opinion.
So you were being treated elsewhere.
It was discovered elsewhere, and I decided that I liked their course of treatment here better.
Right.
The course of treatment there was the removal of my lung, which meant I would have been in a wheelchair for the rest of my life.
Right. So this man, you credit this man with
I do.
pretty much saving your life.
Yes, he gave me breath back.
Yeah.
He
that's
gave
amazing.
me air.
And of course, I guess we're not going to violate any HIPAA rules since she's sitting right here
That's right.
telling the story. I don't know how much you want to talk about the treatment, Denise's treatment, but tell us a little about this story from your perspective.
Yeah, I think first to point out that it takes a lot of bravery for someone like Ms. Meacham to come in here and tell her story, and also to fight through what she's been through. I really want to credit you with a lot of that. You're a very
Thank
brave
you.
woman and giving us a lot of hope. Basically, what we believe is I greatly am humbled by your thoughts that I helped save you, and it really was our process. It was our team. We have a multidisciplinary approach at ECU Vidant. That's not too uncommon, but what is uncommon is that we're very aggressive and we're very efficient. We view everything as an emergency because it's an emergency to that patient and that family. So once we hear, we get patients in very quickly, we get them diagnosed, we get them, and most of all, we get them treated appropriately with cutting-edge therapy very aggressively. And that's what really makes the difference. We heard about Ms. Meacham. We had her in and diagnosed within a couple of days, and then she started treatment within a week. And that included some therapy that I was able to provide, and also some cutting-edge therapy that Dr. Paul Walker, who has really been a true innovator in Eastern North Carolina when it comes to medical oncology, and the head of our program, as well as the other fantastic physicians at ECU and Vidant that really add to our group that's made the difference.
What a story! What a great story! And you're still in treatment.
I'm actually doing radiation now.
Yeah.
Was doing immunotherapy, which is they give you a drug with your, how would you say that? They,
Yeah, so what we found out, and this is really fascinating, it is an exciting time in lung cancer in the fact that we are making real headway in helping people live longer, a better quality of life. And I'm going to go ahead and say it, I think we're heading toward a cure someday. And we just got to keep fighting with people that are as brave as you are and courageous physicians like we have at ECU and Vidant, and especially the nurses as well. But immunotherapy is very cutting edge. It's moving very quickly. And basically what it is we've noticed that a lot of what's happened with lung cancer is your immune system's not working. We probably, who knows, we might have little cancer cells floating around all the time, but our immune system kind of takes care of them and we never see them. When your immune system doesn't act right, then some of these cancers can allow it to really grow and get out of control. So immunotherapy can go in and actually help correct what's going on with your immune system and make your immune system allow it to do what it's supposed to do. And it takes care of the cancer and gets it under control along with some other therapies.
And I'm looking at some of the notes that Erica sent me from Vidant. Lung cancer kills more people than breast, colon, liver, kidney, and melanoma combined.
Yes, sir.
So this is not a cancer that you want, and anyone that has a lung can get lung cancer.
Anybody. That's the most important thing. It's not just smokers. Now,
Yeah.
if you look at it, probably 6 out of 10 of the cases will be related to smoking, but that's almost a third that's not. And what's really alarming is the rate that we're seeing in women. Since 1939, the death rate for men has decreased by 41%. It has increased 102% for women.
Is that right? Any particular?
We're not real sure. And
Yeah.
we don't know if it's hormonal related or what, but
Yeah.
there's a tremendous amount of women being diagnosed, and young women. We're
Yeah.
seeing.
Because you would think that there are fewer smokers now,
That's right.
and so it's interesting to see that it's rising.
Yes, and again, particularly in women. I mean, if you look at the stats, 8 out of 8 women are dying every hour from lung cancer in the United
No
States.
kidding.
So it's a tremendous issue. In our counties, if you look at the 29 counties that we serve, over half of them
Yeah.
have rates higher than the rest of the state. And over half of them have smoking rates higher than the rest of the state. So again, it's an emergency, and I equate this to a plane crash. If you look at the amount of deaths in North Carolina every year from lung cancer, it's around 6,000. If you say a 747 holds about 500 people, that's a 747 crashing once a month in North Carolina, not just Eastern North Carolina. So that's an issue, and you would see press coverage, news coverage constantly on that. And that's what we really got to bring awareness to this. It's a big problem.
I am always impressed when I meet the doctors from Vidant. Has the merger happened? Is it now ECU Vidant? Are we there yet?
I can't
Not
speak.
quite there
I
yet.
can't speak officially on that, but I can tell you for a long time, it's always been ECU Vidant.
Yeah, that's
and
true.
when you talk to the docs on the ground, there ain't no difference. We take care of patients. ECU has always provided what it needs to provide to us. It's always provided what it needs to provide to the patients, and Vidant's always done the same thing as well. We have one goal, and that's to take care of Eastern North Carolina
Yeah.
and to teach people to go on and be good doctors, good nurses, good healthcare workers.
Denise, I bet this guy's a great doctor.
this guy is a great doctor. I was, from the time I came here and I called, I had an appointment. The first week, I was in outpatient with a biopsy. The next week, I was in surgery. And the next week, I was with Dr. Walker starting treatment.
Yeah. Yeah. He's the kind of guy that I would want taking care of me. I hope I don't have to see you, but God bless you for what you do.
Thank you.
And a Brody graduate. That's what we love. We love to hear that story. What do we miss? Anything else you want to mention?
No, I think that the key message to get out there is just anybody that has lungs can get cancer. Get your screening, particularly if you're a former smoker. Talk to your docs about that.
How do you get screened for lung cancer, by the way?
Well, actually, the government will now pay for it, which is the
Is
biggest
it like
thing.
X-rays?
It's a CT scan. You can get one a year if you meet a certain criteria. If you're age 55 to 77, if you've smoked at least what we call 15-pack years, or you or you haven't stopped more than 15 years, you can get a low-dose CT scan. It takes 10 seconds, literally, and that could save your life. Talk
Wow.
to your doc
Yeah.
about it. We got them all over every Vidant and ECU hospital facility. We'll get you there, and I think also some of the other docs, Physicians East, they also do screening. I don't care where you get it, just get it done.
Yeah.
That's the most important thing.
Dr. Mark Bowling and Denise Mitchum, the Dr. Bowling's patient. What a great story. God bless you.
Thank
and
you.
God bless you.
Thank you.
Thank you for the great work you're doing at Vidant Health. That's really, when I hear stories like this, I just think about growing up in eastern North Carolina and how this kind of stuff just wasn't happening east of I-95 when I was growing up here. So I think about what's happened in the transformation of the Brody School of Medicine and Vidant Health. And I can't help but, which is why, by the way, I think we should name that new street Leo Jenkins Boulevard.
I like that.
I always get a plug in for that.
I like that.
What year did you go through, Brody?
I graduated 2001.
Yeah. I mean, if you think about the transformation of this community and what the medical community has meant to the economy, but just the betterment of eastern North Carolina as a whole, and then the medical care that we have here in eastern North Carolina now, because one man had this dream, Leo Jenkins,
That's right.
back in the
That's right.
70s.
That's right.
Yeah.
And I tell you what, they're going to be talking about us throughout the other end of the state with all the work that the docs are doing around here. So it's not only going to be east, it's going to be going west. They'll be mentioning
Yeah.
ECU, Vidant,
Yeah.
and what we do here.
Yeah. Good to see you. Nice to meet you, Dr. Bowling.
You too, sir.
Dr. Mark Bowling and Denise Mitchum. God bless you, Denise.
Thank you.
Continued good luck. I hope you continue to improve and do as well as you look like you are this morning.
Thank you.
All right, absolutely.